Men with low testosterone. Safety concerns that you need to know. Men with low testosterone, low T, who meet the criteria for T deficiency, meaning two low T levels under 300 ng/dl taken before 10 a.m., and are candidates for T replacement, require an adequate clinical evaluation before treatment. Fertility interest. The AUA guidelines recommend a reproductive health evaluation for patients with low testosterone who are interested in fertility. We have observed that most of the patients do not know the impact of the T therapy on fertility, meaning a decrease in sperm concentration, leading to non-obstructive azoospermia or no sperm. It is crucial to assess the fertility concerns of the men and their partners before starting T therapy and to provide adequate counseling regarding treatment options. Transference risk. The AUA guidelines recommend discussing the risk of transference with T gels or creams. In our clinical practice, the primary concern is regarding the potential for T transference in children. Studies have reported that topical T preparations can potentially be transferred to women and children due to residual T that remains on the skin or clothing, with potential consequences. Patients and their families are often unaware of this risk of T transference and do not take precautions to mitigate it, despite warnings on the labels of the products. History of cardiovascular events. The AUA guidelines, as well as the current literature available, describe that low T is associated with major adverse cardiac events, myocardial infarction, stroke, and cardiovascular-related mortality, but there is no definitive evidence linking T therapy to these cardiovascular events. The TRAVERSE study, which examined the cardiovascular safety of T therapy in men with low T and a high risk of cardiovascular disease, found that T therapy was not inferior to placebo regarding the incidence of major adverse cardiac events. The study didn't show a significant increase in cardiovascular events in men on T therapy versus men on placebo. The AUA guidelines recommend that T therapy might be postponed up to 6 months in men who have had a recent cardiovascular event. Prostate cancer and baseline PSA. The TRAVERSE study found that T therapy for low T did not increase the risk of prostate cancer or other prostate-related events. Please watch my video regarding prostate cancer and T therapy for more details. History of breast cancer and gynecomastia. The AUA guidelines recommend evaluating breast symptoms, including breast pain, breast tenderness, and nipple tenderness, as well as gynecomastia, prior to starting T therapy due to a potential estradiol imbalance. Gynecomastia and breast symptoms are uncommon in men. However, missing the diagnosis of gynecomastia and breast cancer will impact the patient's prognosis. Obstructive sleep apnea, polycythemia, and T therapy. The TRAVERSE study found no evidence that T therapy increases the risk of major adverse cardiovascular events, including deep venous thrombosis, compared to placebo. The AUA guidelines recommend measuring hematocrit level and informing the patient of the risk of polycythemia before starting T therapy. Before starting T therapy, all patients in our clinic with a hematocrit higher than 45% are also screened for obstructive sleep apnea, or OSA. All patients with a hematocrit higher than 45% and categorized as high risk for OSA are referred to sleep medicine for further assessment and a sleep study to minimize the risk of polycythemia on T therapy. Testicular size and testosterone therapy. T therapy can lead to testicular shrinkage and a decrease in size due to the body's natural feedback mechanism. When exogenous T is provided, the body stops stimulating the testicles to produce their own, resulting in a decrease in testicular size. One study found that among T therapy patients who reported testicular atrophy, the testes decreased in volume by an average of 17%. This effect is common and can occur in almost everyone on exogenous T therapy. This is not observed in men on clomiphene citrate or in clomiphene. Testosterone therapy is the proper treatment to recover T levels and improve quality of life, enhancing health status and sexual function. Still, it must be safe, and it is critical to have an extensive assessment and counseling before starting T therapy. That's it for today. Check out the rest of the videos on sexual health topics in my channel that I created to help you get better sexual education and improve your sex life. Please give me a like, share it, and subscribe. See you in my next video.